So one of the terms we should look at is gingival margin. Okay, so gingival margin is basically this area right here. Okay, so what I'm drawing over here, this is actually the gingival margin. It's like the outline. So the outline of the gum is your gingival margin. Another thing I want you guys to know is what is your alveolar mucosa. So I know this is not the greatest picture, but you see how this person is stretching their lip up? And this part over here, so kind of this area over here that I'm shading is your alveolar mucosa. So it's basically it's not exactly under the lip because under the lip is your labial mucosa, but closer, I go further down, that over here is your alveolar mucosa. And I'll see if I can find a better picture later on. But your alveolar mucosa is further down. Now, I apologize for the pictures that I have here. I'm trying to use pictures that are not copyrighted, so that are not from the textbook. So I'm taking pictures, I'm drawing pictures, I'm using pictures that I know are completely free from Unsplash, which is a website where you can get free pictures. That is not, you don't have to worry about the copyright issues. So bear with me while I try to explain this using the pictures that I do have free access to, and I don't have to worry about the copyright part. Okay. So alveolar mucosa is the part that's like underneath your lips. Well, it's actually not really underneath your lips because that's your labial mucosa. It goes way down there, way underneath your lip. That's your alveolar mucosa. Free gingival groove. So free gingival groove is, what I'm going to do is I'm actually going to erase this over here. And I'm going to go over the free gingival groove. So the free gingival groove, I'm actually going to draw it. And I'm going to draw it in a dashed line. Okay, so the free gingival groove is basically an imaginary line that's separating the free gingiva and the attached gingiva. Okay, so let's look at this. This over here, so the shaded area over here is known as your free gingiva. And the reason why it's called your free gingiva is because it's free from the tooth. I can stick a probe in there, and this area of the gum is not attached to the tooth. The attached gingiva is the one above. Okay, so in the light pink, that's your attached gingiva, and that is attached, hence the name attached gingiva, right? It is the gum that is stuck on to the tooth or to the root. Okay, so free gingiva is the one that's loose, that's not stuck onto the tooth. Attached gingiva is the one that's stuck onto the tooth. So I want you to imagine a line separating the attached gingiva from the free gingiva. And that imaginary line that we're looking at, that dashed line that we're looking at, that is known as your free gingival groove. It's basically, it's actually kind of like an indent or a depression. So again, you can't see it, I can't see it, but there is a groove that's separating the free gums from the attached gums. Then we're going to look at the mucogingival junction, and this is very prominent in this picture over here. You see this line over here that's separating the light pink from the dark pink? That is your mucogingival junction. So remember, junction is where two areas meet. Okay, so junction is where two areas meet. So let's actually look at this. Where is this word coming from, and where is this word coming from? Well, let me tell you, gingiva comes from the word gums, right? So this is your gums. And muco. I want you to think of alveolar mucosa when you see this one. This word, alveolar mucosa. Okay, so this whole thing over here is your alveolar mucosa. It's like really close to the, it's not under the lip, but it's further down. And this whole thing is your alveolar mucosa. It's dark red. Your alveolar mucosa has a rich blood supply. That's why it's so dark and red, because there's lots of blood supply there. And then the gingiva comes from this part over here, your gums. So junction is where they two meet. So your mucogingival junction is right here because this is where your alveolar mucosa and your gums meet. So right over here with this black line that's where they meet, and that is known as your mucogingival junction. Okay, so let's look at the free gingiva here. So as we said, if I draw this line over here, this is your free gingiva, which is right here, the pink over here. And again, it's located coronal or above the CEJ. So really what that means is your CEJ might kind of be like right right over here. So the CEJ might be here. And your gum is located coronal or above the CEJ. So imagine like this is the root, this is your CEJ, and then this over here is your enamel. So your gum is located coronal or towards the crown or above the CEJ. And it's kind of hugging it like a turtleneck. That's what that means here. And I can probe in this area and it'll be free. The probe will let me go into the sulcus. And sulcus, which we'll talk about I think later on, is basically, I'll show you another picture. This is right over here. This over here is your sulcus. So when I stick my probe in over here, it's entering the sulcus. So this over here is known as your gingival sulcus. Okay, so it's that area that can enter in between the tooth and the gums. So that area that you can enter is your gingival sulcus. So on the outside, this is your free gingiva, but on the inside, if I were to stick my probe in, I am going inside the sulcus. All right, now your attached gingiva is this area over here. And what's interesting about the attached gingiva is that, again, we know it's stuck onto the tooth, right? It's stuck onto the cementum that's underlying the tooth. And it's widest in the incisor and molar area. So like this to this, it's pretty wide. But if I go to the premolar area, which we cannot see, but imagine the premolar area is over here, it's more narrow. So it's widest in the incisor and also the molar area, which is further back. But in the premolar regions, I know this is the central, this is the lateral, this is the canine, but if we go back one more, we'll hit the premolar region and it's the attached gingiva is not as wide there. Why is this important? It's important because at some point you're going to learn how to measure the attached gingiva. And so it's just something to note that you're in the incisors, you have a wide attached gingiva, whereas in the premolar, we have a very narrow width of the attached gingiva. Another thing to note is that the attached gingiva is only found on the outside, on the facial surface. But if I were to look inside in the palate, we don't measure the attached gingiva in the palate. So we only measure the attached gingiva on the outside or facial surfaces or in buccal surfaces. Now, if you look at this person's gum over here, I'm just going to zoom in. Do you guys think that this black thing that we're looking at here, I'm trying to see if I can zoom in. Okay, this will have to do. Do you guys think that this black gums that we see over here, is that considered healthy or not? I'm not looking at the overall gum. I just want you guys to see the black area over here. Healthy or unhealthy? So, if you said that you think that this is just the black area is normal or healthy, you could be correct. What I'm trying to get at is that the darker skin you are, so when you're looking at your patient, if he or she is darker skin, you're going to see some black, sometimes even brown pigment like we see over here. And the pigment is not something we should be concerned about. It's not cancerous. Doesn't mean that it's unhealthy. No, it's just pigment. Some people have more pigment in their body than others. And the trend that we see is that the darker your skin, the more pigment you'll have in your gums. So the attached gingiva will be pigmented. Okay, so if this is a test question, free gingiva is not necessarily pigmented, but the attached gingiva could be pigmented. So if this person was a darker person individual, we would see pigment, such as this black pigment on the attached gingiva. Another thing to note is stippling is present. Now, I don't know if you can see it. It's hard to see, but stippling is kind of like an orange peel appearance. I'm trying to draw this, but basically you would see dots all around the attached gingiva, and that dot would represent stippling. So stippling is seen in healthy gums. So when we're looking at healthy gums, we would see stippling of the gums. And stippling, again, is just dots that you see. It's like an orange peel appearance. So to do that, what you would do is you would take a gauze and you would dry the gum gently, and then you would see those dots. You would see those stippling, and stippling is usually present in healthy gums. All right, now let's look at interdental gingiva. So interdental gingiva Let's get an eraser and erase all this so that we don't confuse ourselves. Okay, so when we're looking at the word interdental, inter, okay, so this word over here, inter, means in between. So this, so these are all interdental gingiva, or in between teeth. So inter means in between, dental means teeth. So gums that are in between the teeth. And so these circle areas are interdental gingiva. There's also another word for it. Anyone think of what word that could be? If you said papilla, you would be correct. So facial, this is known as a facial papilla because it's towards the face. If I were to look at the inside, okay, so the inside interdental gum or the inside gum in between the teeth, on the inside would be the lingual. Outside facial papilla, inside lingual papilla. Okay, and we like seeing interdental gums, or we like seeing interdental gingiva, because if we didn't have it, food would easily get stuck in between the teeth. So the interdental gum prevents the food from getting packed in there. Okay, we kind of talked about the gingival sulcus, which, as we said, is the area in between the tooth and the gum. So here is the tooth, here's the cementum, here's the bone, the pink is your gums, the white is your connective tissue, which we'll talk about later on. But this area over here, which is between the gum and the tooth, this area over here is known as your gingival sulcus. So I'm just going to write that over here as well. Do you guys know where the junctional epithelium is? I'm going to highlight it. Junctional epithelium is right here, the base of the pocket. So the base of the sulcus is your junctional epithelium. So if I were to probe here, my probe would stop over here. And when my probe stops over here, that is your junctional epithelium. So the base of the sulcus, or the bottom of where where the end is, or the bottom of where that gum hits, is known as your junctional epithelium. All right, we'll move on to gingival coal. So here we see a tooth. And I'm going to see, Okay, so we see a tooth over here, okay? And this is your gums. So when we're looking at this area over here, the area that is, if you're looking at the gums, you can see a valley-like depression. Like you can see that indent that I've kind of highlighted in black. That is known as your coal, okay? And it's just basically found when you have two teeth touching together, and you look at the cross section, you'll see an indent over here, and that indent is known as a coal. So if in here we can see two teeth are, fairly close together. Oops, let me just undo this. So here we see two teeth that are fairly close together, and I'm going to see if I can draw them a little bit more closer together. Because, oh my gosh, what is happening here? Let's go back. Okay, so we have one tooth over here and another tooth over here. So here the two teeth are touching. And then if we look at the gum over here, and if you had to go to a cross section of the gum over here, it would have a depression-like valley-like depression basically, and that is known as your coal. Now, you will not see a coal if we have a large space between the two teeth. It is only present when two teeth are very close together. You also will not see a coal when there is recession. So recession is when the gums have gone down. So if the gums have gone down, you will not see this depression. Just things to keep in mind. Something really cool is called the GCF, or the gingival crevicular fluid. So in everyone's mouth, there is some fluid that we see inside our, actually we don't even see it. We can't see that we have GCF, but there is fluid that is inside our sulcus, or inside our gums. And when you have a healthy mouth, you don't have a lot of GCF. You don't have a lot of fluid. But when you have an unhealthy mouth, so when you have a diseased mouth, when you have gingivitis or periodontitis, that is when you'll see a lot more GCF, a lot more fluid. And there's ways to test it out, which we'll look at later on, but just something interesting to note.